Hi, I'm Dr. Webb. What we're going to cover in the next few minutes is thyroid. And is the thyroid affecting you? Is it affecting your weight? Is it affecting your sleep? Do you really have a thyroid problem? A lot of confusion out there, and hopefully within the next few minutes we can clear that up. First, I want to let you know that your thyroid gland sits right here, and your thyroid gland affects literally every cell in your body, and if you're not producing thyroid hormones, you got to get it corrected, or you got to be on thyroid, or you would die. It's very, very important. So if you're on thyroid medication, don't change anything, but I want you to understand this. Only about 10% of those suffering from thyroid symptoms in this country have a true non-functioning thyroid. Well, what's that mean? Well, your thyroid gland does produce thyroid hormones, but there's a big process that goes along for you to actually be able to activate and use these thyroid hormones. And a lot of problems are coming by the way that we're being tested out there. So let's take a look. We've got this thyroid gland up here. It sits right here, and it produces what's called thyroxine, or T4. Now, T4 is an inactive form of thyroid. Your body can't use it. And what happens is when we have T4, when we have enough of it in our system, it'll come back up and it'll basically go to the brain. There's a gland called the hypothalamus, and it will read whether there's enough T4 or not. And if it's too low, if it's low, it'll tell the pituitary gland to send TSH, thyroid stimulating hormone, to the thyroid to produce more T4, and you have this loop. So here's where some of the problem comes from. You're flustered, you're gaining weight, your energy's down, your skin's gotten dry, maybe some ridges on the nails, maybe losing some hair, maybe not quite as much as I have. Sleeping problems, maybe even if you're a woman, maybe even some menopausal problems. Because thyroid does affect so many things, digestive problems. So you go, you get tested, and this can go either way. Let's say you come back, the measurement of your thyroid stimulating hormone, your T4, comes out normal. So the doctor says, well, you're normal. There's nothing wrong here. Well, if my lab tests are normal, doctor, why is this going on? I'm doing some study, and to me it seems like a thyroid problem from what I understand. Well, unless you're being tested correctly, you may be right. And in fact, I listen to my patients because innately, we know our body, and we know when something's wrong. So here's the thing. T4 has to be converted into an active form of T3. And that takes place within your liver, your digestive tract, the blood. And there's a lot of things that can go wrong to where that conversion doesn't take place. For example, let's say that you're having some digestive issues. You've got adrenal stress, which can produce that. We talked about that in a video. So right there, that could create a conversion problem. If cortisol is too high, that can block conversion. If you're a woman and you have too much estrogen in the body, that can actually tie up T3 to where you're not using it. So there's all of these different ways that we can have thyroid symptoms, but the initial test of TSH and T4 normal. So these two are the ones that are usually tested, and all the other things aren't. So when I look at thyroid, I want to look at TSH, I want to look at T4, I want to look at T3. There's actually free T3 that I want to look at, and some others. The free form is just really the unbound form that we use, okay? So I want to look at these, but I also want to look at some other factors. One of those is called TPO, all right? So what is TPO? Well, in this country, when you have a lot of thyroid problems going on, as a female, as a woman, more times than not, in fact, the majority of cases where we have thyroid symptoms is due to an autoimmune response called Hashimoto's. Now, Hashimoto's is a autoimmune response that you'll have antibodies attacking your thyroid. And often it is found, sometimes it's not, and we look at TPO, sometimes it can show up just because it comes back normal the first time. Doesn't mean you don't have an autoimmune, it just may not be activated at that point in time. So if you have this autoimmune response called Hashimoto's, and the only thing that they do is they just put you on thyroid hormone, well, the problem with that autoimmune is still affecting your health, and it's affecting it in a very, very dramatic, terrible way, because it's attacking cardiovascular, so we can have more problems there. It's attacking the pancreas, so it could lead to insulin resistance problems, even diabetes, and it affects our bone, osteoporosis, and over time, short-term memory can turn into long-term memory because it does affect our brain. It can create dementia problems. So you've got to turn that autoimmune response off, and there are ways to do that. A lot of times in traditional medicine, they're not looking at this. Again, they simply give you the thyroid hormone. So that autoimmune response, even though you can't ever make it go away, there is ways to turn it off, to dampen it, so you don't have that response. So when you're going to be looking at thyroid hormones, again, you've got to look at TSH, you've got to look at T4, you've got to look at free T3. In many cases, you've got to look at TPO, thyroid peroxidase, to determine if there's an autoimmune response. And when you are put on replacement, the most common form of replacement is Synthroid or levothyroxine. Now, what those are synthetic forms of T4. So again, once we're on it, let's say that the first test came back and your TSH is high, meaning that we're not producing enough T4, the doctor says, oh, you're hypothyroid. Well, maybe at just that course in time, but the minute we put you on a thyroid hormone, you're going to start turning off your thyroid. It will begin to atrophy, and if you're on those thyroid hormones long enough, you may not be able to get it replaced. So they put you on a synthetic, and the synthetic is synthetic T4. Well, if you're not converting very well T4 to T3, you're still going to have thyroid symptoms. Now, your blood tests, again, if they're just looking at TSH and T4, well, no, see, it worked. Miss Johnson, it worked because those levels are okay. Well, doctor, why am I still having symptoms? And my weight's still going up, and I'm having these problems. Well, again, we're not looking at the whole testing here. So there's different ways to work with your thyroid. First and foremost, we always try to get your thyroid working, but then if it is going to need replacement, it's very likely that you may benefit much better with a bioidentical T4 that has a combination of T4 and T3 in it to be able to use. So I know that's a lot of information in a very short period of time, but to summarize once again, if you're having thyroid symptoms, the chances of you having a really true non-functional thyroid is not that great, and you need to really discover really which course is going on. Are you truly having thyroid imbalance problems because of a conversion problem? Is it because other hormones are out of balance? And if you do need replacement, what's the best type of hormone that's going to benefit you without the side effects and give you the best type of relief and turn these symptoms around? And then thirdly, if you have an autoimmune response, you've got to find out, and that has to be turned off, or you're going to have a whole barrage of other health problems. So I hope that helps. If you really want to learn the whole gist of how stress, hormones, belly fat are health problems, find out one of my next presentations is coming. We cover this. You'll have a ball. You can find that on this site. We'll see you soon.